Life support machines beeping. These machines are racing around the clock to save the lives of patients on admission at the ICU of the COVID-19 Management Center of the Ridge Hospital. Palgrave was on one of the life support machines. He went through a procedure called the continuous positive airway pressure, popularly known as CPAP. Thanks to doctors and machines here, he's going to be discharged. He has this piece of advice for you watching or listening to this report.
Can there be a conversation around COVID not being real? I think that is evidential enough. I mean, it's evidential. I mean, if you start having lostness of breath, if you start struggling to breathe, if you panting for air, looking for oxygen, you are being rushed into ambulances, I think it's evidential enough. I mean, you don't need rocket science to know that it's not real. It's extremely real. I mean, I've experienced it. I never doubted that it wasn't real. I wasn't surprised that I didn't get COVID. God has just been good, amazingly good. So if you think COVID is not real, well, maybe just give it a try.
Palgrave is not alone in the ICU. He was with Ibrahim, Kofi, and some others. Ibrahim went through an intubation procedure because he could not breathe. He shares his recovery story and some pieces of advice for the general public.
Let me say COVID because me still me fan say and have a bet who say yes. There's something called COVID. So be a who see pa say obehoron insa obe sanitize because the woman no embaye na wanya oxygen and for si wo so a wo mu an.
Kofi is still on a ventilator, also known as a respirator or breathing machine. It is a life support treatment that helps him to breathe. He finds it difficult in breathing on his own. The machine pumps oxygen into his lungs and his body and helps him to get rid of carbon dioxide through the lungs.
COVID is real. People will be playing around this, and before we realize, we'll be losing lots of the youth in Ghana. As youthful as I am, I've been infested with COVID.
Hold on, do you mind? Let me ask your age and how you've battled this. How old are you?
I'm 32 years.
32? Have they told you that you have any comorbidities?
No.
Wow. How are you pulling this one through?
Well, I think it's just the grace of God. And the doctors are really doing well. Offering human service that I think they are just doing what God has asked them to do. They are really doing well.
So if you need oxygen levels of about 15 liters per minute, we give you the non-rebreather mask, because that residual oxygen, when you breathe it in, it gives you that 100% oxygen. So the effort is about 100% from the oxygen to you. Now, so when you begin to recover, we bring you down to about 10 liters of oxygen. Then there is a simpler mask which doesn't have the bag attached to it. So we call it the simple face mask. That is what we give to you to show that you are recovering.
Kofi and others on admission here need these machines and health officers to survive. But it appears the ICU is understaffed.
Staffing is a problem here. Imagine a 16-bed ICU. We have only 3 critical care nurses.
Wow, 3.
And the rest are auxiliaries who are helping them. So ideally, there should be a critical care nurse at every shift, because people are on ventilators, people are on oxygen, but we don't have that numbers.
The team lead at the center, Dr. Emmanuel Ahiable, outlines some of the challenges the center faces. He continues by calling for government's immediate attention.
The first 2 cases of COVID-19 in Ghana in March were brought here, and they were kept at the 4 ward. But there was a time we thought, this being regional hospital, we need to, scale up and build a bigger facility. And this place was built in October. And as a result, we are under pressure. So, like I said, we need more equipment. That's to upgrade this place so that we can give optimum treatment to our patients. Equipment such as monitors, patient monitors. We need oxygen. Oxygen is also very important here. We also need logistics for testing, and we also need some multivitamins, some drugs.